first of two Inside Government shows tonight produced by Cuyahoga Community College for the spring 2017 semester here at the college. We are shown on Time Warner Verizon, Time Warner and Verizon Fios, as well as the college's television station. Yeah, can we do that all over again? Sorry. Yeah. You know what? I thought I could
have a sip of water.
I will. So let me finish the story. So I think that phone call came in at 5:45.
Which one?
About
The first closing.
last Friday.
On
Last Friday? Yeah.
Yes. Yeah.
Yeah.
Stop waking me up this early in the morning.
Well, it's supposed to go out at 6.
Well, it didn't, okay? My first thought was not about our... Good evening and welcome to the first of two Inside Government shows produced by Cuyahoga Community College for the spring 2017 semester. These are shows that are broadcast on Time Warner, Verizon Fios, and the Auburn Regional Media Access ARMA, as well as WIN 89.1, the college's radio station. I'm your host, Guy Cosentino. Last month, Governor Andrew Cuomo released his 2017-2018 budget that increases school aid overall, but does not address issues such as foundation aid, which we'll be talking a little bit about tonight, which impacts many upstate New York school districts. After the governor's announcement, Superintendent of Schools Jeff PIROZZOLO, in a statement noted that without a change or increase in aid, the school district may have to lay off up to 24 plus employees. To discuss this and the current state of the district's budget process, we have the Superintendent of Schools here, as well as his business manager, Lisa Green. For the record, Ms. Green serves on a board of directors for which I am an employee of, and I just want to make sure we're on the record on that. So welcome both. It is that's that odd time of year for both of you right now. You're putting together a budget, continue to put in a budget, because you started in August. Am I correct on this?
We did.
Where you don't have the biggest number you need. Am I correct on that?
Correct.
Okay, we'll come back to that. Let's talk about the weather. I have never started a show talking about the weather, but yesterday the two of us were at a Wednesday morning roundtable, and you're out in the hallway with the phone connected to your ear trying to do your math of how many snow days you have left. How many snow days do you have left?
Actually, we have 2 snow days left. This has been quite a winter. Early mornings, 4:30 every morning. Speaking with Larry Garucci, our director of grounds, our director of facilities. We've spent a lot of time talking with other superintendents, Mike Talbot from the city, trying to make good determinations on whether to cancel school, 2-hour delay.
So what goes into that determination?
We usually call our guys in between 2 and 3 o'clock in the morning to get our schools cleared out. So first, we want to make sure that our schools are all cleared out, sidewalks are cleared and all salted, so that our staff and students can enter into the school safely. But then we also got to make sure that the city roads are clear. A lot of times we'll have our buildings cleared out before the city can have all of their roads, because of course.
So you got 80 miles worth of streets.
Exactly.
Okay.
So, it's all coordination piece, and also looking at what the future weather's bringing in. So we take all that into account. We really try to stay away from 2-hour delays as much as we can. When we have 2-hour delays, our kids don't get breakfast in the morning.
Okay.
And also our AM BOCES is canceled.
So one of the efforts that this district has made over the last maybe decade has been this issue about walkable schools, where you'd like to not have to use buses. But that does impact how you call a school versus if you were busing everybody.
Absolutely, because our kids have to walk. We want to make sure sidewalks are shoveled. So a lot of times we'll do the delay to give families extra time to get out and shovel the sidewalks so our kids aren't walking in the street. But we drive around the cities and we look at those things. We see how high the snow is on the sidewalks, whether parents are getting out there and families are getting out there to shovel. The 2 days before Thanksgiving break, when we got 35 inches of snow, there was no way people were clearing out that quickly. So we were closed 2 days.
So schools close next week.
Thank goodness. We can sleep in.
You can sleep in. So thank you, because I'm loving your phone calls. So I'm going to ask you about that. You use a messaging service, which is great, but I want to ask you about that. But if we do get hit with, you have up to 2 more.
Correct.
What happens if we do get hit with something like Thanksgiving? What happens then?
So right now we've got March 17th is a staff development day, superintendent's conference day. We could bring kids in half day. That would
And
help
this is
them.
mainly because of state aid formula issue.
Correct.
I mean, you could close school, but you won't get money for that day.
Correct.
And that impacts your budget. How much does
Absolutely.
that cost you in a day? Any idea?
Oh, jeepers, it's
I don't know.
few
Yeah,
hundred thousand.
But it is
Yeah.
still, it's real money.
Oh, absolutely,
Okay.
absolutely. So really, we have kids have to be in seats 176 days. That's if you have 4 superintendent's conference days.
Okay.
We do 3 of them, so our kids have to be in their seats 177 days
Okay.
throughout the school year.
So I mentioned this messaging system, and other than you calling me at 5:45, and I think I don't even have well, yes, I do have a child now in the district, but when you started calling me, I think it was just because I was in your personal phone.
That's good. That's
the
right.
problem.
That's right.
You are utilizing this a lot. What benefit, has that changed the way the school district operates when you can do these bursts?
Oh, absolutely. I still have to get up in the morning. I have to call Tom Bunn, who's our director of technology, and get the phone call all set up to go out. And I have to call the news channels and the YMCA and the police department, our food services, our director of transportation. I make all those personal
So
calls.
how did we deal with it 10 years ago? How?
Then we had to call every single person and put phone trees into place.
Okay.
And now we don't have to do the phone trees. So I have to call about 10, 15 calls in the morning versus 50 calls.
And the community will end up knowing what's going on.
Correct. And I get it out on the news right away before they receive the phone call. So those that get up early will see it running on Channel 9 or Channel 3. So we get that out there. And then I like the calls to go out about 6 a.m.
Yeah,
I
really.
try not to go before 6
Then
a.m.
apparently it's just to your friends.
And the message system is great for other purposes too, and it can be targeted just to certain schools, so that if there's a play or something or a concert at a certain school that night, you can target a message to go to remind parents about it.
I think it's a great system.
great
I'm very impressed by it, but when I get it, it says AESD alert on my phone, and so it's usually weather, but I know you've used it for some other.
Oh yeah, even like our
Reminder
P-Tech
of
students.
half-day, yeah.
Our P-Tech, we've
So
got.
say what P-Tech students are, because not everybody knows about
So
it.
our P-Tech is a pathway to manufacture where we have cohorts of 25 students. One group's in 10th grade, the other's in 9th grade. They're on a 6-year track, and in 6 years they'll get their Regents diploma plus a 2-year associate's degree from CCC.
That's why I was asking you.
Yeah, I know. I figured it was. And again, they get their college education for free.
So sometimes they will be coming to school, but the district may be closed, but the college tends to be open.
Right. So we can designate just for those 50 kids that are in that group. We can design just a phone call for those 20. So we really can set up any type of group that we want.
Okay. So let's bring it back to the real reason we set this up originally, was to talk about the governor's budget. So the governor, about 4 weeks ago now, released his budget. How did he treat schools overall?
Overall, I mean, with the $1 billion, extra, I was quite surprised.
So does a district like Auburn, is it getting an increase?
We're getting an increase, but we're getting the same increase that every other wealthy school across the state is getting. So we're getting, what, a little bit over 2%?
Our foundation aid is increasing about 650,000, which is about 2.25%.
All right, so let's explain foundation aid, because how this conversation started with you and I, we happened to be listening to the governor's representative at City Hall, who was outlining the governor's budget, and you and another person stood up at that meeting, talked about, well, the budget's great, except in your case, you mentioned there, and it kind of took some people by surprise. You said foundation aid isn't changing here. This is going to, in fact, impact us, and that's when you said at that meeting 24 or more people. So tell us what foundation aid is first, so people understand that, so they know the basics of that.
Yeah.
Foundation aid is the basic general aid that we get from the state. There's various categories of aid, and they're targeted for specific things, like we get reimbursed for money that we spend on transportation or money that we spend on BOCES. But foundation aid is an amount per student that we get from the state, and it varies year to year. But back in 10 years ago, in 2007, there was a lawsuit, and as a result of that lawsuit, the state implemented a foundation aid formula, and their plan was to fully phase in that dollar amount and give each district full funding of that foundation aid over a 4-year period. And then the recession hit, so we got 2 years worth of that phase in, and then
there was this gap
then there was a
elimination,
gap
which is the
elimination
Patterson
adjustment.
administration.
And
So
that
they
froze.
actually took money away from us.
Right.
So not only did we not get additional foundation aid, we lost money.
So do you have any idea of, since 2007, 2008, how much the district has lost?
Oh, absolutely.
We've lost in foundation aid, because it wasn't, as a result of it not being fully funded, we've lost about $81 million,
And what is your annual budget?
73 million.
So at least a full year's budget you've lost in the last
Absolutely.
10 years.
10 years, okay.
In addition to that, we lost $24 million to the GEA, the gap elimination adjustment. So
But
$105 million.
that piece has been corrected, am I correct? Is this?
Well, it's gone.
Last
It's gone,
Yeah,
last
it was
year.
corrected,
Okay.
and again, with the efforts of a lot of our legislators, especially, Senator DeFrancisco, Assemblyman Finch, they got us moved to a high-need school district, so we started receiving that money a little bit earlier.
But it's money that we lost that we'll never
Get back.
Okay, so if you talk to state senators or assemblymen, they will all say the system is broken. They all seem to agree on that.
Yep.
They also know that to fix it is a giant political issue.
Absolutely it is.
It's a budget issue too, but it's
Political issue as well.
because while it would make sense to tweak it to bring what I'll use is, and I don't know if you would agree with this, poor districts like Auburn into line, you would leave richer districts alone. Maybe you would increase them or decrease them, but at a minimum, leave them flat. That takes a lot of political will. But no senator who represents a high wealth district is ever going to want to go back and say, we took care of places like Auburn, but we didn't do
Absolutely.
this. So you're talking about a giant political nut and a giant financial. Any idea how much it would to make everybody whole?
Oh, it'd be billions.
It's
Billion.
about 4.3 billion.
Yeah, it's
If they
billion.
were to phase in totally and fund the foundation aid formula as it's currently written.
And do you think they'll ever do that?
No.
All right, so with that being said, you have to go through your budget and start calculating stuff. So you are where in your budget process right now? You released something on Tuesday night. That was what?
The state requires us to have break out our budget into 3 components: an administrative portion, a capital portion, and a program component. So we are required to review those with the board and the community. So we started Tuesday night. We reviewed 2 of the 3 components.
So you haven't put a full budget together?
No.
Okay.
We have a budget together, but it's not balanced.
Yeah.
But it's also not released to the general public?
No.
Right.
No,
Okay.
we are actually having a board workshop next Tuesday evening to look at different
So
options.
even though school's closed, you're still going to be?
We're still going at it.
So let me ask you the basic question that everybody keeps talking about if you're in any type of government, that's the tax cap. So what under the mandated tax cap, what is your rate this year?
Our tax cap limit this year is just under 4%.
Okay, So work with me on some math here, because it's known by everybody as the 2%
that's
tax
right.
cap. So we
Exactly.
had the mayor on 2 days ago, and he knows that his number is likely going to be lower than that for whatever reason. Why is yours so high? And by the way, I'm not sure you could ever get the public to agree to 3.9.
Oh, no,
I think
no.
it's,
yeah,
is it- did I read it?
absolutely.
398.
398.
Yeah,
I
right,
read
yeah,
that number and I thought, well, I got to ask you about this
Yeah.
question. So why is yours higher? And are all school districts higher?
Every school district, municipality is different. Everyone starts with the CPI, the Consumer Price Index, which was 1.26%. So that's everyone's starting point, but there's a formula that you have to go through that allows you to add and subtract items such as any pilot agreements you have, payment in lieu of tax agreements. You look at last year's and the upcoming year, that's part of the formula. And then you also look at an exclusion for your share, the local share of debt service. And in our case, we had some money left over from capital projects from years ago. And the only use that you're legally allowed to use that money for is to pay off your debt service. So over the years, we've used that money at a rate of about $400,000 per year to reduce our debt service. Well, now that money is gone. So we lost that revenue source is gone for us.
Okay.
So that was about $400,000 that now, because of that, our local share of debt service is $400,000 higher. That is part of the formula, and it allows you in the
So you got penalized for
calculation.
paying off early.
Well, it actually allows you to raise
Your tax.
increase what you can levy.
No, but you wouldn't be able to do that unless you had paid off. Am I correct on that? You had to
That's
pay
right.
off that $400,000 each year.
Yes.
Yeah.
Okay. So with that being said, with what the governor produced in late January and where you are today, immediately after his presentation, you had said there's about a $4 million gap. Is that what you still have?
Well, it is,
Okay,
but
so-
we're looking at using $1.6 million in reserves.
So how large is your fund balance now?
Right now, we're
Our fund balance is it's 4% of our budget,
Yeah.
so it's about 2.9 million.
Is that a safe range for
No,
school districts?
it's not safe, but that's the limit that the state, that's the
Okay,
cap.
so it's a sort of, there's a standard limit, because I know some have said it's got to be 6, 8, 10%.
15.
Okay.
I think 10 to 15 is a realistic.
absolutely.
And that's when you were at the city, that was the goal over there as well. Am
Yes.
I correct on that?
But the city doesn't actually have, there's no law that limits what the city can have.
So why do they limit school districts?
School districts, there's state law. I don't know why.
And I'd rather
it's
get my
different,
hand
but-
slapped for being over that limit.
But your hands would be slapped.
That's
Would that impact what you could raise the tax levy? Is that a calculus in there too?
No.
If you're
No.
Okay. So,
You've got many school districts, and again, the foundation aid formula is a tough piece to understand, but we have schools that are wealthy surrounding us that continue to get wealthier and wealthier because they continue to get more aid every year, even though they don't
and they
need
would
it.
never go to their voters to ask for a 3.98% tax
Right,
increase.
they're
They
doing
never,
a
they
zero,
never have to.
they're doing
0%.
0% tax increases
Right.
every year.
And we here in Auburn, we would never go to the voters and ask for 4% anyways, because at some point the state's got to take control and say, you know, there is an issue of equity here, and our higher poverty schools are continuing every year to get way less than what our wealthier schools are getting.
So by using the 1.6, is it 1.6 or 2 million in the end that you would be using from the fund balance?
1.6.
Okay, so 1.6, that brings you down to 2.4.
2.4.
Okay, that's still a big gap.
Mhm.
If you went with that model, can you keep all the programs you currently have?
No, unfortunately, we are looking at staff cuts, and when you're cutting staff, that's cutting programs.
So you said 24 to 30, is that still the number you're looking at?
It's 30 plus.
Yeah, it's probably
30 plus. And is that instructional and,
It's a combination.
It's a combination,
so it's instructional and support staff
correct.
And
And
do you-
administrator.
and administration? Do you know where those cuts are right now?
We've got a couple different plans and
And
options.
a lot of that's based on seniority, am I correct on that?
Well, it
Union-
is.
Involves
All of it's
seniority.
based on seniority as far as once you decide what areas you're going into. So currently I've been meeting with the principals, the administrators. Yesterday I met with groups of teachers and trying to vision out where we see ourselves 10 years from now, what programs are working well, which ones need tweaks, and trying to take all that information in to make a good decision on where we need to go as far as cuts.
So the flip side of that, there is an impact. Besides on the individuals, which is important, but it will impact programming come September. So does that, if you had to implement all of that type of large cut, how many employees do you have overall?
About 600
600.
full-time.
So you're talking about
Yeah.
5% of your employment base. You could lay off at some point. Am I correct on that?
Yeah.
Hope I'm doing my math
Yeah,
right.
no, you're right.
That impacts class size. Am I correct?
It could.
Could.
Okay.
Yeah, it could. It could impact class size. It could impact different models that we use for special education. It could impact art, music, phys ed.
So your
music.
extracurriculars.
Yep. I mean, so it could impact a lot of things, and that's really what we're investigating right now.
And do you have to make these decisions that you're working on now prior to April, assuming that the governor and the legislature get a deal on April 1st, that's the goal. Do you have to make decisions prior to that in
We
the sense
don't.
of notice requirements for?
Oh, yeah. Oh,
Okay.
absolutely.
We don't
yeah.
have, the board has until around April 20th to
But con-
formally adopt a budget, but
And
realistically.
I think we're having you
Well,
on the
contract-
week after that
right.
to explain it, but
Contractually, though,
you have notice
We have
requirements.
yeah, we have
notified.
notice requirements for teachers and
For layoffs.
secretaries
Okay.
for layoffs and transfers.
So in doing all of this, continually who has always come to the rescue at the end of this drama is the legislature. They've always come back and said, we'll do more money. And they've been able to get away with that because they have either had legal settlements or a good economy. We now know that the state comptroller, the governor, the legislature have all said tax revenues are down across the board for a lot of variety of reasons. That usually means there's not a big pool of money, and let's say frankly, the governor's got some new ideas. He wants to give free tuition here. He's got some other items that he's rolled out. How confident are you, or are you confident at all, that the legislature will be able to fix that $2.4 million gap for Auburn?
Again, are we expecting to get a little bit more money? Probably.
Because that's just the politics of it.
It is. We don't know the amount. We don't think it's going to be a great deal.
How much did they add? Do you remember how much they added last year at the last minute? Because they did come in with a.
They did, and some of it was a
They
was
did,
a
but yeah, we found-
community grant.
It was several $100,000, but we found out after our budget was adopted that $200,000 of it was restricted, that we didn't
Right.
know about that until.
It was a community.
So how did
community
that
school.
impact your budget in a sense? Does that mean you ran into a deficit, or you had to make cuts in the middle?
Well,
of it?
no, we had to do a lot of switching around.
Right, we had to-
We were planning on using it for SRO because they
School
are
resource
yeah,
officer,
yeah.
okay.
So
But that
because
wasn't allowed.
but we weren't allowed because it was a pre-existing program, so we had to use it on new programs.
And I am assuming, I think I saw that the local districts have met with some legislators already. You're still doing, I know you can't legally do lobbying,
Right.
but you're doing advocacy.
We are doing advocacy.
And what are they telling you?
Really, it was more or less us sharing our issues with them at first. That's what we were at the process we're at. Sharing our concerns about foundation aid, about the tax cap. Really like to see the state go to a flat 2% tax cap every year, because we know next year we'll probably be in a position where we'll be well under 2% that we'll be able to
Because
grow.
last year you were under.
0.12.
Yeah,
Right,
almost
okay.
zero.
Yeah,
Okay.
0.12%.
And for those who haven't been paying attention to this fluctuates based on a lot of different calculations and formulas,
Right.
and nobody can plan long term.
Correct.
And it
Not
seems like the
really.
biggest obstruction is the governor doesn't. Legislators are all. I think I see them on both sides of the aisle are fine doing this as an established
Right.
number.
Yeah, they
need
are.
the governor to go along with it.
Correct.
And it doesn't affect the biggest delegation, the biggest delegations, which are the big cities and New York City. Am I correct?
Correct.
So unless those
Big-
delegations will do an override,
The Big Five, yeah.
it won't do that. Okay. There is a glimmer of good news in your budget, is that you don't have West Middle
Yes.
on your
Correct.
tab right now. How much is the, well, first of all, for those who don't know, you are transferring West Middle, or have you already
We
transferred?
have already
Did.
done it
Closed on
mid-January.
January.
So that's gone to
12th.
2+4 Unity House.
They've
They're
already ripped
gone.
it all apart.
They have.
Oh,
They've started
I
up on the
was-
third floor
I was
renovation.
in there about a week and a half ago, and they had already gutted the third floor, and they were working on the second floor, the main floor.
And I know you've been in other places, you've done updates on what's going on there, but what is going in there?
It's going to be affordable housing. So them in partnership with the Unity House are going to be offering affordable housing that will, I forgot,
Mainly
56
59 units.
59
mainly
units.
And the district has
One
no
resident.
more role in this?
No,
No,
And this gives you a cost savings of about how much now per year?
but
about
$100,000.
100,000.
I kind of segue away for this. I've always asked this of superintendents in the first of the two presentations in the spring. Who is up for school board this year?
We have Eli Hernandez, Monica Salvage, and Carol Souls.
And do you know if any of them are running or not, or they
I'd
haven't?
love to have all three of them run over and over again, but I'm not sure. Not all of them have committed one way or another.
Has anybody committed?
I
I haven't heard.
know
Okay.
I know
Just
Mike
curious.
McCall, our president, has been speaking with them. But yes, I would really love to have all three of them run again. But
So if they don't, or if other people step up, I've asked this of J.D. Pavis, Constance Evelyn, and before that, what type of characteristics do you want in somebody who is thinking of running?
child focused, student centered, what's best for children. That's always number one. We want people to come in there that are there for children. But we want somebody that's got innovative ideas, especially budgeting purposes, but is
What's the time commitment?
the time commitment is, of course, we meet twice a month, are our board meetings, but it goes way beyond and above that.
Well, I'll just say, for example, on Sunday I happen to be at the Auburn play, and
Board members are there.
Mr. Hernandez and Ms. Souls were both there.
Correct. And I was with Kathy Rhodes on Friday night.
There are a lot of community events,
All-
and school events, but other even
Well,
committees.
committees,
We have a lot of
that's-
committees that
We
meet.
have 6 or
between
7
board
committees,
meetings.
and each of them.
And how does somebody find out more about how this works? Do they go to board meetings? Do they give you a call? Do they give other board members a call and say, listen, tell me what this is. Tell me the truth.
Yeah, they
all
go
of
into
those.
go into the board meetings, absolutely, and we've already got a couple of community members that are already starting to do that.
Because the worst thing is for somebody not to go to any of these meetings,
And-
and all of a sudden they win and they show up on July
they're
1st.
like, and they,
you're
I,
like,
don't, I didn't want
wait
to
a
do
second.
this.
Okay.
But definitely to call my office, I will sit down and meet with anyone that would like to go through this. But yes, absolutely reach out to board members, especially board members you know. Out of the 9, there's probably somebody that you know that's on the board.
And petitions can be picked up roughly when?
In March.
March, okay.
And
they have to be
those
filed
right.
by the 27th or 28th of April.
Right, and you'll be able to pick those right up at district office at Harriet Tubman Building.
Okay.
Here.
I did want to talk about a little bit about the discussion yesterday on Kevin Harris talked a little bit about extracurricular activities and the need to avoid, it helps people avoid addictions, especially children. Can we deal with that in April when we have you both on at the end of the month?
Absolutely.
I want to thank both Jeff Pirizzolo, the Auburn Superintendent of Schools, as well as the district's business manager, Lisa Green, for giving us a budget update and telling us where they are at this particular stage. They'll be back at the end of April, 1 week before we have our school board forum, because voters do get to go to the polls in May to vote on a budget. In a moment, we'll be back with another Inside Government with the Cuyahoga County Director of Community Services, Ray Bizzari, for a discussion on more than $4 million in new grants coming to this community to fight addiction locally. On Tuesday, we'll have Assemblyman Gary D. Finch. I'm thinking we're going to talk about school funding there.
Sure you will.
In the studio for an Albany update and specifically discuss the governor's budget for 2017. We'll also have on Beyond the Front Page, John Wilcox of Ignite will be on to talk about Ignite the Winter, which is the first Friday of March, and he'll be on to talk about that event. The next couple of weeks, we'll have other guests that will include Senator John D. Francisco, who will talk about the budget as well, Legislative Chair Keith Batman from the Cuyahoga County Legislature, Owasco Town Supervisor Ed Wagner, and on Beyond the Front Page, we'll have shows focusing on Cuyahoga Centers, local efforts on the Make-A-Wish Foundation, Seymour Library, and the Women's Rights 19K run in Seneca Falls, among other topics. I'm assuming you do that. Do you do that race? You do, okay. Before we go, though, we would like to let you know that we do want your questions and your ideas for guests. You can contact us at cozguitho@aol.com or Inside Government or Beyond the Front Page at care of 141 Dunning Avenue, Auburn, New York 13021. I'm Guy Cosentino for Cuyahoga Community College. We want to thank you for watching. We hope you have a good night, have a great tomorrow, and make sure to stay tuned for our next show in just a moment. Good evening and welcome to the second of two Inside Government shows put together by Cuyahoga Community College for the spring 2017 semester and broadcast on Time Warner Communications, Verizon Fios, the Auburn Regional Media Access, ARMA, as well as Win 89.1, the college's radio station. I'm your host, Guy Cosentino. Over the last several years, there has been a great deal of media coverage over the problem of addiction, and specifically the increased use of and abuse of opiates and heroin. We've had several shows here, in fact, with our guest tonight to talk about that issues. Often two issues that we come away with are a lack of treatment options and, more importantly, the issues of prevention strategies and their costs for implementing them. Recently, Cuyahoga County was awarded more than $4 million in two new grants to fight addiction locally, as well as to deal with this issue, those issues revolving around education as well as treatment. We're joined in the studio tonight by Cuyahoga County Director of Community Services, Ray Bazzari, to discuss the grant awards, as well as an update on strategies being put in place in the community for prevention, fighting, and treating addiction. Welcome back.
Thanks for having me.
Great to have you here. Before getting into these grants, which is great news for you and your office and the community as a whole, there was a story a couple weeks ago about usage in regards to deaths. Interviewed you, the county coroner, Adam Duckett, who we've had in before. Are opiate and heroin related deaths steady? They down? They up? Where are they in the big picture?
I think they were down last year, but I mean that's kind of a misleading statistic. I think that Narcan, which is revives people who overdose, has been pushed out widely to the community. You can get a prescription for that if you're a parent who has a kid who uses, right? Or if you have somebody, friends can get it.
Do we have any idea how many people have purchased or had access to
No.
Narcan?
No. But I would say there's quite a bit of it out there. I think that the fire department routinely resuscitates people. So yeah.
So that would be in their counts.
Just the ones that they do. I think that regular folks have it, and I think that there has been situations that have come to people's attention where, a group of people will be using and, resuscitate each other.
And then not go to...
Doesn't report anywhere.
Doesn't report to the county, doesn't go to a hospital or
No.
anything like that.
So I think that, it's nice that, we're not having as many overdose deaths, obviously, right? I think for those families, it's still a terrible thing. But it's hard to use that as a way to pin down how much use is going out there and how many overdoses are actually happening, because people have the ability to resuscitate people on their own.
So I may refer to this a couple times tonight. Yesterday, you, Kevin Hares, and a new staff person,
Jolyn Mulholland,
who's with the Drug Free Coalition, spoke at the Wednesday morning roundtable.
Yep.
And one of the questions that came up was whether, separate from the HEAL group and what they're doing in their education efforts, is education working? And I thought I heard one of the comments was it works for the first 72 hours, and then there's a diminishing returns on that education.
I think that...
And that wasn't said by you.
I think that's important, though. That's an important question. So I think prevention is a big thing. We have to put resources into it, and we want to roll it out broadly across the county. I think that the 72-hour thing sort of related to, when you do those things with the cars, right? The DWI stuff at the schools, and there's a car, and they show that and all that sort of stuff. And I think when we present things that way to kids, they'll be shocked by that. I think that wears off, because I think that if that worked, and we didn't really have any more problems. It's just scare kids. I think
Kevin Hares said that. He
said
that. No, you said it. If you could just frighten people,
I could be king.
Everything would be solved.
I would be king, but I don't have a crown. I think that there's a lot of research out there that talks about the kinds of things that do work with kids. And when you look at, so we have information that we've gotten from school surveys, and it's sort of consistent. You pull a bunch of different levers. So these one-off things that you do, I think that they're important when they're part of a larger strategy, but as a single standalone strategy, they're not that.
And do we have,
helpful.
So this, I picked this up yesterday, and I'm skipping way ahead into the grants. It came across to me yesterday that what we haven't been doing is having that unified strategy, because we haven't had paid coordinate. Not saying that everything has to be paid for, but to do a bigger strategy. We have been, we, and I say that as the royal overall community, since you're the king, do we do a good job at information and referral? I mean, we have the Human Services Coalition, but that's about whether you've got a specific item and a family comes to you
Right.
and do that. Do we do a good job in this particular area, whether it comes to treatment? And when you talk about addiction, you are not just talking opiates
No,
and heroin. You're
right.
talking alcohol, other items.
Alcohol is
right?
still the first drug of choice for kids.
Okay.
They have the easiest access to it.
So how are we doing on the information and referral process?
So what do you mean by that, I guess? So you're talking about access to services?
Access to services.
So there's two things, right? There's treatment, which is access to services. There's prevention. So I think that we're doing better on both fronts. I think there's been a lot of initiatives, been a lot of regulatory changes, and a lot of resources are being pushed down, mainly regionally, but there's still things that you can do locally. So yeah, we're involved in I think when I think about, or when we all talk about access to treatment, there has to be multiple doors for people to be able to enter, right? And once they're in, they have to get everything that they need without going to other doors to continue. So we're doing a better job of integrating, services.
And will either of these two grants, the $4 million or the $400,000, go to help those efforts as well?
No, not on
Okay.
the. So.
Well, let's
Sure.
walk through what each one is. So let's talk about the big grant.
Okay.
So $4 million is for what?
So these are system of care sustainability grants. So it's a SAMHSA grant. It's related to children's services, children being 18 years old and under. So we in our county, what we did was both of the work in both of these two things, the community coalition to do substance abuse prevention work, and the work that was done before the SAMHSA grant for system of care was awarded. So you don't need money, really, for a lot of things. So the money came as a result of the work that was already going on that wasn't being paid for, that people were just participating in because it made sense to lay the groundwork for these things.
So did you apply for these grants, or were they just somebody from on high? Because, for example, the city
No, we applied.
ended up with
No.
a visitor center they didn't solicit for.
No, we
Okay.
applied. A lot of work goes into SAMHSA grants. So I'm fortunate, I guess, right, to have the Department of Social Services and Mental Health, right, because these are the two agencies that do.
They've merged and they're under your.
Well, they haven't merged. They're
run-
not merged, but it's running them both, right?
Okay.
So we have state aid that pays for services. We have preventive contracts that pay for services. So depending on what door kids went in, they got what was available in that room. So if you were a social welfare kid, then you got the services that were available through the Department of Social Services. If you were a mental health kid, you got the stuff that was available through the mental, and the two didn't meet. So we identified, like, really we took the smartest people in the county working on this stuff, right? So Department of Social Services, mental health, contract agencies, probation department, school districts, put them in a room. And they worked at this for a couple of years around how to create one door. So they created one door. We blended the funding, so all kids and families go to one place now. They get a sort of a consistent sort of assessment of need.
And where is that one place?
It exists at County Mental Health. So
Okay.
it's called the FAST team. It's Families Accessing Services team, but it's multidiscipline. So there's a lot of people participating. It just happens to be located there because it's tied to children's SPOA. SPOA is a single point of access, so it's a coordinating sort of entity that allocates resources. So they started doing this, and we braided the funding so that kids could get whatever they needed no matter where they came from. So sometimes you have to make a kid and a family something, right? They have to penetrate a system. They got to penetrate the juvenile justice system, right? Or the mental health system. Get service. So we sort of got rid of all of that. So they really laid the groundwork for this. They were doing tremendous work. And then the opportunity for the SAMHSA grant came up, and that effort, Liz Burke at Mental Health, Maureen Brennan at Mental Health, there was somebody from Cuga Centers. There were some other folks that worked on that grant, and
So what
we
will
got it.
So what will it provide?
So what it does is, it operationalizes, we've moved from all the services that we're funding through this grant is an expansion. So they're evidence-based practices. These are home-based sort of services. Multi-systemic therapy, functional family therapy. These are
what is-
replicated.
So somebody who doesn't know what functional family therapy
Functional
is.
family therapy is an intervention that goes into the home. It's limited. It's based on some really good science and research. It's been replicated all over the world, which means that its results are you get the same results no matter how it's operationalized. and it helps support increase in family functioning, helps create strategies in the home to sort of manage behaviors and keep people safe, and it's very focused on working on it doesn't come from a deficit model, it comes from a strength model. It's really about partnering with families, and so we bought a bunch of that. Multi-systemic therapy is a more intensive sort of family-based intervention, and it's related for kids with juvenile justice intervention, so kids who are committing crimes, status offenses, like truancy and stuff like that. Substance abuse issues. It's more focused on building those sort of competencies in families to be when we send kids away, they don't do well, so we have to keep them at home as often as possible, and so we bought those services. We also bought a couple of evidence-based parenting programs where we have neglect families that have neglect and things like that, and we want them to improve their ability to raise their kids and keep them safe. And so these are the kind of services where, again, they're based on science, so you can sort of tell where somebody is when they come in, you do the intervention, and you can test to see whether their functioning has improved, as opposed to the sort of subjective assessments that we made before. Bought a lot of respite. It's also being, and then it's also all the other services that we pay for all sort of go through FAST for the families. University of Albany is the evaluator for this project, so they were hiring somebody to work here locally. So now we're going to be able to take a look at families and the interventions that they had, and then see what works, so we can continue to refine how we sort of deploy services in people's lives. So
when you say respite services, what are respite for those?
Respite is, we have two kinds of respite. We have respite that's center based. So there's staffing and supervision there all the time. So kids that we're really concerned about safety issues with them, can go there, and they can be they're watched and stuff like that. And then we have family home-based sort of respite for like younger kids and kids who aren't at that sort of level. So you do it as crisis and you do it as planned.
And so whether it's planned or crisis, and you kind of addressed this yesterday, it's all voluntary.
All voluntary.
You can't keep somebody.
Not in this model. We have ways to keep people.
No, but you
Right.
you talked about yesterday, if somebody went to I can't remember what treatment facility you were talking about, if they go there, if that person wants to get out, they can get out.
So that was relative to using sort of a pickup order function to put intoxicated individuals someplace against their will. You can't do that.
Okay. So some general concepts about the bigger $4 million grant. Is there a local share?
No.
So this is one of those rare state grants that doesn't come with a
It's
local.
federal.
Federal grant. No local. Okay. The second one, once you have these things in place and you buy these services, is it sustainable in the long term, or is that something that Cayuga County will have to invest in?
So we have, so it's sustainable in the sense that if we can demonstrate that it works, and it's reducing placements, reducing hospitalizations, reducing foster care admissions, increasing family functioning, keeping kids safe, we're going to have some research that's objectively conducted, that's going to tell us. Our experience tells us we've made great gains already. So we already had contracts for a lot of these services before. So what this would cause us to do would be to deploy our resources in a way that's more meaningful. So we have access to the 100% state aid money, which doesn't have a share. And we have open-ended preventive money, 62% federal, state, 38% local share that we write our contracts for. So it's just, to the extent that it's going to keep families, safe and healthy, and keep kids, safe and healthy, keep them in school, and then we'll make that investment, because one placement in a residential treatment center, is $100,000 a year.
So with that in mind, and these in general numbers, with this type of money, are you talking about serving 10 families, 100 families, any idea?
I mean, we're serving a lot of families, probably got to be between 200 and 300 a year.
Okay, so just so people have
200 and 300 a year.
This is what this is going to
We have the capacity to serve many families because we have some flexibility in some of the other services, that we have to you can drop things in and you can pull them out, and we're part of what the FAST teams I think what happened before was you threw a bunch of stuff at families, right? You hope something stuck. We didn't really pay as good as attention to that as we should have. So I think now there's more of a focus about the right service at the right time, get in, get out, which means that we should be able to spread the resources over a greater number of families, looking for shorter term interventions. We find that, so we're using a lot of parent partners to support the parents navigating the system, because was the system confusing based on my discussion yesterday?
Yes.
So imagine if you were in a crisis as a family member and you'd be like, what do I do? And then we also have mentors that are attached to kids. So you're really trying to get people to buy into the idea that they have some control over what happens to them, and that their ideas are important. And then we work from that perspective, as opposed to, we've been very paternal, the system. This is what's wrong with you. This is what you need. This is what we think you should do. And a lot of people, they don't like that.
But that grassroots organization, that's what will make it a success, though.
I think so. The research points us in that direction, yeah.
And that's how, I mentioned the Human Services Coalition. That started because parents
Didn't know where to go.
20 years ago, couldn't do that. So now this goes. When you, and I think it was Under Sheriff Stowell and Kevin Hares were here some time ago.
Mm-hmm.
I'll go back to that interview in a second, but you had talked about the lack of treatment beds, and I know this has nothing to do necessarily with this grant.
Same thing,
Is
though.
it still an issue?
So, first off, the entire system is moving away from inpatient stays. I mean, this is what Medicaid redesign is, moving,
For financial reasons, not because it's a good idea.
financial reasons, but also too, I don't think the research doesn't really support that a lot of these things work too. So it's like, they're nice. It's good for people to know that somebody's safe in a way, but you can problem solve it another way. But so, however, yeah, they're moving away from it. Access to treatment beds. I think that OASIS, that's the agency, the state agency that does substance abuse services, has done a lot of work about eliminating the sort of barriers that prevented people from getting access to the bed. So now there's no more prior authorization. You get 14 days now. Insurance companies can no more tell you that you're not eligible for an inpatient stay because you haven't failed at outpatient, 6 or 7 times. There's a tool, it's called Locator. All the insurance companies, Medicaid, and have to use it. If the tool says that somebody needs this level of care, they get to go. And they get to stay there 14 days before the insurance company can even evaluate whether or not they want to pay for it. They have to pay for it.
And is 14 days enough?
I think that there's people that need long-term care, and there's people that need that can get by with shorter-term care. I think people would say that 30 days is a better hit.
So for this first grant, the $4 million, that's being overseen by your office.
Mm-hmm.
Am I correct?
County Mental Health, yeah.
Okay. So then,
but it's a collaboration of providers that are really.
But you're the point.
We're the grantee. Yep.
Just as so, then there's the second $100,000 grant over 4 years.
5.
5 years. So $500,000.
With a option on another 5.
Okay. So what is that for?
So that's a prevention grant. These are drug-free communities grant. So to be eligible for one, you have to have a functioning coalition.
Okay.
You have to have a functioning coalition for a couple of years, which that's what I mean about not having to have money. So there's like 25 people representing all different sectors of the community have been planning and doing stuff for a couple of years around prevention stuff. So you get the drug drop boxes, you get all these different sorts of stuff around the.
So what was done at the Sheriff's Department where you could drop off, which is still there, I'm assuming?
And the APD has one now too.
Okay.
So a lot of that stuff and a lot of other things, public awareness campaigns and the fight against synthetic drugs and awareness and all that sort of has come from that. And then that grant was written and then it was awarded. CHAD's the agency that's implementing that grant. Confidential help for alcohol and drugs.
Okay.
And so the coalition develops some strategies based on the data. So going back to your original question around the one-offs that last for 72 hours, the things that are concerning about substance abuse with kids is more about their perception of harm. When you take a look at the data, kids don't really seem to believe that. Quite a few kids think that drinking, using prescription drugs, stuff like that aren't necessarily harmful. They don't think that their parents think that it's harmful, and they don't think that their peers think that it's harmful. We have to change that. So the strategies that we're employing with that grant, what Jolene's job is to figure out, what's happening in other places of the country that's moving the needle on that sort of stuff, because we'll keep doing those surveys on kids, and we'll be able to determine whether or not their thinking has changed. It won't change because we scared them. It'll have to change because we change the way that they think about it. So you have to go at it in a bunch of different ways. There's other things to do too, you know, the laws around host parties, that kind of stuff, the bigger stuff where, you know, you're really limiting people's access to alcohol, kids, training for...
Should we be more restrictive or less restrictive
On what?
on host parties and things like
More
that?
restrictive.
So I ask this because there's obviously, and I won't get into the
Right.
specifics of that particular
Yeah.
case, but I am stunned, and I don't have children who are teenagers, so it's easy for me to say.
It's coming.
Yeah, yeah. We'll see if I survive. But I am stunned when parents say, "Well, it's okay if it's at my house and I'm there."
So you could see how that would make a kid think that their parents would approve of their drinking under certain circumstances. So we have to do something about that. That can't happen.
Okay, because
It can't happen.
I am stunned, you know, when that occurs, and I hear about it all the time, and I'm just,
Right.
and to me, it's surprising.
I could see why, you know, obviously, right? So, I mean, you know, yeah. So, you know, if it's happening at they're going to do it anyways. I think people think they're going to do it anyways. If they do it at my house, they can keep an eye on them.
So
But
is there-
people get sick and go to the hospital at those
Okay.
parties.
So, I know your heritage, same as mine.
Right.
You most likely had a little old grandfather or grandmother who would give you a taste of anisette.
Fortify you.
Fortify you when you were 4 or 5 or 7 or 8.
Right.
Is there any difference between that and these host parties?
So I think that, yes, I think that there is. I think so. Some cultures, I mean, you have very low rates of alcoholism in a lot of European countries because I think it's introduced early. It's part of, celebrations. It's done in moderation. It's done in connection to something. It's not done because it's Friday night and there's a football game.
Right.
And, yeah, so I think that cultural part, I mean, that's different than letting 30 kids come to your house, hang out in the basement under any kind of supervision, and they just binge drink.
So, this grant, is this $500,000? Is that being used in conjunction with this drug-free coalition?
Yeah, actually, even though, so the grant's going through Chad, but the Drug-Free Coalition, which is a collection of a bunch of different people.
Okay, so tell us who. That's where I want to go.
Right, so
Because
you
you mentioned 2 different groups yesterday. You mentioned the Community Services Board
Right.
yesterday and the work they do, and then there's the drug-free. So what's the difference between the 2?
So the Community Services Board is a statutory requirement in counties, and they oversee the developmental
And that
disabilities.
comes under your purview.
Right. They hire me on that job. So you remember from your
Yes.
time over at Options, developmental disabilities, substance abuse, and mental health. So the responsibility of that board is to oversee the services and kind of hire me and supervise me and all that sort of stuff. The Drug-Free Coalition has representatives from like clergy, business, media, law enforcement, education, youth, parents. So it has all these like sector representatives, and they're the ones that hired Jolynn.
Okay.
They're the ones that
So
supervise
do all
her.
communities have these drug?
No,
Okay.
no, but they should.
And their task is to do what?
Is to develop, implement, and operationalize an effective substance abuse prevention program, countywide, for youth 24 and under.
And do they meet publicly? Do they have regular
Every-
meetings? And can anybody attend?
Third Wednesday of every month, noon, County Mental Health Center on North Street. It's an open meeting, and everyone's welcome to come.
And so Jolynn Mulholland came on board when?
No, man, about like 6 weeks ago, maybe.
Okay, and so her task, she's come on board. She's working for Chad and the coalition.
The coalition supervises her. Chad
Okay.
sort of pays her.
And what is her work plan? I know we invited her yesterday. She may come on at a future date.
Sure.
But what is her work plan?
So, like, part of the grant is you have to develop work plans for like alcohol. I think we picked. You get to pick things. So we picked alcohol. We picked opiates, and I think those were the 2. There might be a third. Just trying to remember this. And then there's all these. You develop all these different strategies that you will implement that will move the needle on how kids perceive substance use. Her job is to take those and make those happen.
A couple minutes left. A couple just generic
Sure.
questions. You also mentioned yesterday. I thought you said $30 million new dollars from the governor's budget.
From the governor's budget for substance abuse services.
And is that enough?
Better than nothing.
Okay.
I think it's. I think they. I have to
Do
say.
you think
like,
that's sustainable money in the sense the governor's put 30 and it'll always at least stay at that amount and keep moving forward?
I think that they've been making significant investments in substance abuse treatment over the last 3 years. I think that I think that he seems to have given SAMHSA or OASIS pretty much quite a bit of latitude to develop to combat this particular, because it's a plague upon us. So I think that I think that they've done a really good job. I think you can always argue that more is needed. I think that people can do that. I think that we have some new tools, and I'd like to see what they can do.
So you say it's a plague upon us. So a couple of years ago, I mentioned the three of you were in here. I think you did 2 or 3 shows with the undersheriff and Kevin Hares, and you make a great team. One of the comments that I thought was made at that time was, at some point we think this will burn itself out, that it would. Why didn't it? I think you were all of the, we also, by the way, have thought a lot of stuff in this country in the last year that doesn't come to pass, but that's the national issue. But cyclically, you looked at what had happened in the past, and at some point it just burns itself out. It just doesn't seem to have.
Maybe the difference with this one is that this had started. So crack cocaine kind of burned itself out, right? Some synthetics, more or less, kind of burned themselves up, but they're still kind of around. The problem with this is that we're creating sort of new addicts every day. If folks are getting, if they're getting 90 OxyContins, you know what I mean, and they're eating them, then they're getting another 90, then they're getting another 180, and then so we're creating new addicts. So there wasn't you couldn't go to a pharmacy. That's just me thinking. I don't even know. You just ask me. I'll give you my opinion. I could be wrong. But you can't go to the pharmacy and a doctor won't write you a script for crack or for cocaine, right? Or even for marijuana. But you'll get it for OxyContin. You'll get it for all that sort of stuff, and it's all over the place. So you go to your grandmother's house. You go into the bathroom. You open up the thing. You see the orange label. You're like, my friends are taking these. Right. They think they're cool, so I will too.
What's your biggest worry down the pike?
People dying, really.
I'm sorry, let me rephrase that. I understand that, but in a sense, is there anything, obviously heroin, opiates are still an issue. Is there anything, and I know there's been this issue of fentanyl, and I'm not exactly sure.
Yeah.
Fentanyl is what, and how is it getting mixed in?
Fentanyl is a synthetic pain reliever. I don't remember how many hundreds of times more powerful than heroin it is.
And is it getting mixed in with? It's
getting mixed in, and people use it as well too. It takes a really small amount to overdose on. It's not. I don't think it's illegal I don't think fentanyl in its purest form is illegal because it's a synthetic drug. It's not on the schedule. I think that people. The thing about heroin users is, they acquire such a tolerance, so they're always looking to get high.
They're also not paying attention to it.
They're not paying attention. You can't tell. It's a bunch of white powder. You don't know what's in there. So there's a lot of fentanyl around now. Very dangerous. Very deadly.
Else, these synthetics, is that a big worry as we continue along?
They've stayed. I think that the chemists stay one step, and particularly in the synthetic stuff, they tweak a molecule, and then it's legal again because it's not. You can't test it. You can't test it. You can't keep up. So chemists are pretty smart. A lot of stuff coming in from China and things like that. I think kids are. It's really dangerous. This has really affected the level of. The level of addiction in the community, all communities, is higher than it's ever been. I would say. But you still have you have alcoholism. You have that. You have a bunch of stuff. But now you have this.
Congratulations on the grants.
Thank you.
Thank you for coming on to discuss this. As you know, the door is always open. Our guest has been Cuyahoga County's Director of Community Services, Ray Bizzari, to give us an update on what is going on with the 2 grants that have been received that total, I guess, close to or more than $4.5 million, and in some cases can be renewed. We'll be back on on Tuesday with 2 new shows. We'll have Assemblyman Gary D. Finch in on Inside Government. He'll be asked about the governor's new budget, as well as other issues relating to upstate, including ride sharing and school budgets. That'll be followed by Beyond the Front Page, where John Wilcox of Ignite will be on to talk about Ignite the Winter, which will be held on March 3rd, the first Friday of March in that event. Over the next couple of weeks, we'll have several shows on our Inside Government shows. Senator John DeFrancisco will be here, Legislative Chairman Keith Batman, as well as Owasco Town Supervisor Ed Wagner. Beyond the front page, we'll have shows on Cayuga Centers, as well as local efforts of the Make-A-Wish Foundation, Seymour Library, and the Women's Rights 19K race, which will be in Seneca Falls in May. Before we go, though, we would like to let you know that you can give us your idea for guests or thoughts for questions by contacting us at Inside Government or Beyond the Front Page at COZGUYTHO@AOL.com or 141 Dunning Avenue, Auburn, New York 13021. I'm Guy Cosentino for Cayuga Community College. We want to thank you for watching. We hope you have a good evening and a terrific tomorrow, and we'll see you back here in the studio on Tuesday.